UNITY VCS is indicated for use during anterior segment and posterior segment ophthalmic surgery. Federal law restricts these devices to sale by or on the order of a physician. Appropriate use of system parameters and accessories is important, as improper use may result in patient injury. Please refer to the directions for use for complete indications, warnings, and safety information. For full important product information, please visit unityvcs.com. References and disclaimers related to topics discussed in this podcast can be found in the description.
What a time to be alive in Retina, am I right? It's an honor for me to present Unity for All from our podcast booth, where I have the honor of speaking with two distinguished speakers with intimate experience with Alcon's new Unity platform. We're going to spend some time today discussing some of the technology and experience with Unity and the potential impacts on surgery for the patient, the surgeon, and the surgery center. Our guests today are John Kitchens and Matt Cunningham, two surgeons who need no introduction. So first off, guys, let's get right into it. I haven't used Unity aside from in a pig eye. You guys have used it, in the R&D phase and in patients. Tell me, I want to hear what your experience was like for you in the R&D phase. Dr. Cunningham, why don't you kick us off?
Absolutely, and it's a pleasure to be here with you and with my colleague John. And it's a fantastic platform. Through this R&D phase, through the different initiations, I've had an opportunity just to play a small role in giving my feedback to Alcon and the whole team. And what an amazing feat for Alcon to take an amazing Constellation machine and make it more efficient, make it more user-friendly. There's so many things I'm excited about with this system that we'll go into in a little bit more detail. But John, what are your thoughts?
Yeah, Matthew, I've done this a little longer than both you and Sarwar, and what I've come to appreciate is that in our careers, we might see a new machine 2 times, 3 times. If you're Steve Charles, maybe 6 times, because the iteration cycle is 10 to 14 years. And so to have an opportunity to actually be a part of the initial development and launch of this was just a really great experience. We know Alcon makes top-notch equipment. Yeah. And to see what they bring to the table with their next generation system, I think it's something we've all been looking forward to for 5 or 10 years. And to get hands-on with it was really amazing.
And even in the pre-clinical evaluations, to see how they took our input and actually turned it into real-life changes just speaks volumes to the company that Alcon is.
Yeah, I love that. So what was, based on your experience with the technology in the R&D phase, what was, when you first were presented with this platform, what was surprising to you? What was exciting to you?
I'll jump on that, John. I think the first thing for me, the Tetra for laser spot is just phenomenal. I don't, we do so much laser when we're doing vitrectomy surgeries.
Yep.
That I cannot tell you and stress to you how efficient this is and how much time it actually saves. When you're doing hand retinal photocoagulation, you're cutting it down by 1/4 of the time. And it really, I found that to make a huge difference. The other thing, it might seem like a simple thing, but just now we're just doing one wireless foot pedal. Mm-hmm. And, so you're able to do laser as well as all of your vitrectomy functions with just one wireless pedal. And even though it's minimal, these are the kind of changes that lead to efficiency.
And ergonomics too, right? I feel like I'm
right.
reaching with one foot, barely balancing on that chair. And if it's not locked, you start rolling. It's a whole show, What about you, John?
Yeah, I think coming from Constellation, the bar is set really high because that is a great platform that's been so robust for the last 14 years that I thought, what can they do to really beat this? And then the second thought I had was, how are they going to really make flow-based vitrectomy a reality? With this, it really feels like you're operating with Constellation, but with the control of flow-based vitrectomy. And when you really see that difference is in mobile retina.
Correct.
When you're shaving over mobile retina, you can see no retinal movement, but yet you can still have the speed to do a core vitrectomy in less time than it takes you to do with the 20,000 cut per minute, 25 gauge Constellation cutter.
Yeah, I think that 30,000 K cut speed really shows itself, and you can use and utilize 27 gauge platforms and still be just as efficient as 25 gauge in a Constellation, but when you add in that 25 gauge along with the Unity, that's something special as well.
You know, the thing, Matthew, that I love too is you still have a Venturi-based system built into there. So in this small form factor, really beautiful machine, you have a Constellation on top of everything else. So if you want to do vitrectomy under air, you can do it, which is something I love to do.
Tell me a little bit about vitrectomy under air. I mean, I love what you said about the pressure dynamics. I'm kind of in a pain, you know, when I'm with pressure and surgery and even in the clinic. But like that decompression can be disconcerting, you know, especially even when you're taking oil out, you know, like that decompression can make a big difference, you know. And I think some patients are particularly sensitive to that decompression, not just for choroidals, but I think, you know, like the optic nerve can get shot, especially in our really myopic patients. You know, when you decompress the eye, the nerve looks funky.
Yeah.
You know, tell me a little bit about, like, you guys have both used this in patients. You mentioned the 4-point laser. Like, how has the experience been for you?
Yeah, so first of all, you can operate at a much lower IOP, and that's because they built in redundant sensors throughout this entire system so that you actually have much more precise control over your IOP. I think that you have the ability to control not just vacuum, but what's coming out of the eye. So I can tell you, I was operating routinely at pressures of 26, and I'm a 35 guy, and the eye felt just as stable. So it's really a game changer from that standpoint.
You mentioned operating under air, and what I imagined is, you know, doing vitrectomy under air, you have this additional third hand that's not PFO. Talk a little bit about that. I think that's super interesting.
So I've really loved operating under air. I've done it for about 15 years now, and I credit to Steve Charles. Steve taught me a lot about how to vitrectomize under air. It is so efficient. And what happens is when you go to air, and we all see this, and you look and go, oh my gosh, look at that, how much vitreous I left behind, particularly on like a buccal vit, where you might have a phakic eye, and you're like, man, I really couldn't get aggressive about getting that vitreous out. What the air does is it pulls that vitreous back. So you're now further away from that lens, and you can readily identify it. And back in the old days of 20 gauge vitrectomy, when vitreous would come out of the eye, you could vitrectomize it outside the eye, and it'd go away in an instant. And that's what you get under air. So you have the ability to kind of shave down anteriorly over tears and areas of excess vitreous, eliminate it right away. It's a little bit of an adaptation, though, visually. So you have to kind of use some two-dimensional cues, shadow and whatnot. But it really helps me get rid of excess vitreous right away in those tough cases.
Love that. Super cool. I definitely need to try that. You know, the Unity is supposed to have like really good connectivity and like supposed to be very simple to set up. So, you know, when related to patient care, how do you think like the ease of the setup, the connectivity of the machine will affect the OR team and like the overall flow, you know, in wherever you operate?
So I can tell you when we first demoed this at our surgical center in Orlando, it literally took a 10-minute demo with my surgical staff, and they were up and running. They were able to set up everything. I'm talking, you know, a couple minutes. And the turnaround time, you know, usually we try to get the next patient in about 10 minutes. The rate limiting step was not the setup of the machine.
Wow.
And that speaks volumes, especially when you're trying out a new platform. So from what my experience is, obviously we're still fresh into this data, but you know, my gut feeling is that this is going to speed up the efficiency of that turnaround time.
Yeah, Matthew, I tell you, it's more than your gut feeling. We're going to have data behind that. So Sarwar, we did a time and motion study at our practice and with practice in LA, looking at everything from setup to tear down to time for surgery, time for laser, time for core vitrectomy. And although I can't discuss the results because we haven't fully analyzed them, it does look like there's going to be a statistically significant difference in setup and tear down with this machine as opposed to the Constellation.
Love that. I mean, honestly, like less steps and simplicity. I mean, we've all been in situations where we're operating in the middle of the night and, you know, nobody knows how to set anything up. And, you know, that's why, you know, like we train a lot of fellows to like know how to set up our machines. So do you feel like it'll also make a difference in that when you have a team that doesn't necessarily know or is intimately familiar with the equipment?
Yeah, I absolutely do. I mean, I didn't have a chance to set it up while we were doing the demo or the time and motion study, but I can tell you from the feedback I've gotten from our staff, including having a few nurses that were in training in there, it seems like it's going to be much more straightforward. The touch interface in the screen is absolutely beautiful. But one thing I really love is the new surgical cockpit and how this integrates with Unity. Not only do you get more parameters that you can see on Unity, or on Ingenuity, but you also have the ability to totally control your Ingenuity from the foot pedal.
I like that.
So there's no more asking nurses, can you scroll over and do this or that? Now you can do it all from your foot pedal.
And that's important. We're 100% Ingenuity users, so that interconnectivity and that talkativeness between the two platforms is really important, because especially when we're looking at even just changing to like a brilliant blue or a green, the hyper green mode, all of these things are, sometimes it's a rate limiting step to ask your nurse to scroll over and click the drop down menu to move over that color channel. So I think if we're able to do it ourselves, we're going to be utilizing that technology a little bit more.
And it gives you a little brilliant reminder on the screen to tell you what your foot pedal does, which I thought was just genius. So oh, this cycles through my channels, this moves me over a setting. It's so well thought out.
Yeah, it's so interesting. I operate in a lot of different places, and I have specific settings. I like doing everything off the foot pedal too. I don't like asking anybody to do anything. But the thing is, even despite like how specific I am with my foot pedal controls, like there's still stuff that I want it to do that I have to ask the scrub nurse to assist with, and that's another. It's time.
Yep.
Yeah.
And also, we all deal with this, right? Sometimes you're in the middle of a critical step, right? Like for example, when you're doing fluid air exchange, you don't really have time. You're like losing your view, or it's like half the time we all operate under, like most people say like, oh, like, what do you mean you can't see? I'm like, dude, we're retina surgeons. We're used to not seeing. We usually operate at like a 20/100 visualization, especially in a phakic patient in a long case, So like anything to make it more efficient, I think is great.
Yeah, I think especially when you're training, we don't have a fellowship now, but I could see how, when we do develop a fellowship, or if we have a trainee that's learning with us, you really want a platform that's going to be very user-friendly, that it doesn't take 10 people in the room to set up, and something that's easy to tear down and set up for the next case. So I think all of these things, even from a usability platform and just a usability perspective, is going to increase efficiency.
What I'm kind of excited about is even with the Constellation, right? There's so much you can do with the machine that a lot of people don't even fully utilize. There's like different settings. You can create a vertical scissor function. You can alter like the cut speed and like the aspiration rate to like make your cutter do certain things. And I feel like this is even more so. So I think it just behooves all of us to sort of also learn some of these things, how to utilize all the different technology.
Yeah. And John, I don't know your thoughts on this, but when I think about Constellation and I think about Unity, I'm often reminded of like these updates that we get to like our Apple, right? Your Apple iPhone. And this Apple iPhone is already a fantastic device that does more now than we could ever imagine. How do you make it better, right? So kudos to the engineers, kudos to the team to say, to really do a deep dive into what would make us more efficient. One thing that we haven't talked about it yet, but oil removal, oil injection.
Oh God.
A lot of times, a lot of retina specialists will use a higher gauge, a 23 gauge or a 20 gauge platform, because they want that to be done quickly. While doing that with 25 or 27 gauge on the Unity, it's so efficient.
Yeah, I love that you mentioned oil, because I remember like several cases, as an attending and during fellowship, where I'm removing oil, and some of these eyes are so sensitive to IOP, is that as I'm taking the oil out with 25 gauge, choroidal started to form, just because every eye is different. And I think one thing we don't talk about a lot is sort of the scleral elasticity and rigidity. So that flow control inside the eye, I think, is super important. And I think like another safety parameter that I think is great.
Yeah.
This makes 27 gauge oil a reality, which I never thought would be possible.
Wow.
You want it put in oil 27 gauge? Fine. You want to take it out with 27 gauge? Fine. You can do that too. But back to your point, Matthew, I remember when Constellation launched. And what's amazing is that they're still updating it 14 years later with meaningful updates. The fact that you can integrate that machine with an Ingenuity and have heads up information, it's like how well thought out that is. And then I look at this machine and I go, okay, wait a second, we're just at the infancy. What have they put in this that we're going to see with time, and how much can this change and evolve over time? And I think that's really exciting.
It's exciting. I'm a little jealous of the fellows that are like gonna get to like
Yeah.
know this and like not anything before. Like I remember using, in fellowship, they have one of the older machines, and I was used to the Constellation. And I was like, how did you guys operate with this? Back in the day.
Yeah. And John made mention of this earlier. For the older surgeons that are not as amenable to change, the Unity has the Constellation technology already embedded. So if you don't want to utilize that flow-based control, you can literally turn it off and you have the Constellation. And I think that's really important, because I think this platform, not only from a vitreoretinal standpoint, if you have cataract surgeons in your ASC, it's so easy to the setup is so easy to just do a cataract. Now, we don't have cataract surgeons in our ASC, but I think that would definitely be something that would be extremely attractive for the flexibility.
Matthew, you're right. For older surgeons or surgeons that say, I don't know if I really want to transition off of Constellation, there's a real familiarity with how this machine works. So the flow-based vitrectomy really feels like Venturi-based vitrectomy when it matters the most, meaning you don't have to chase vitreous and you have great stability. Yeah. And so that's what's so unique about it. It's better, but it's not so different that you're going, what is this?
I think that's a really, like we mentioned about, it's not just like surgeons. I mean, I think we all become less amenable to change. It's sort of the passage of time. I feel like I've become that way too, and I do things a certain way. But I think, so for example, I operate at a few ASCs and like a couple of hospitals. The hard part, as someone like who wants to use the latest technology, and I think a lot of people are really excited about the next generation of surgical platforms, is how do you convince our ASCs? Like, we care about patient safety, we care about the efficiency of surgeries, especially with constantly declining reimbursements, which is why I want to just remind everyone, the fee schedule for next year came out, surgical codes are being cut, so we actually need to be more efficient, because there's a big opportunity cost for being in the OR, but we all love being in the OR. How do I convince these places that I operate at that, that yes, the older technology is great, but the newer technology will not only help the patient, but from a cost standpoint, it'll allow the ASC, which, I mean, unfortunately, like at the end of the day, it's all about dollars and cents, that it's actually a decent move for the ASCs. And this is just me asking these places, please get me a Unity, guys, if you're listening, these ASCs.
Well, John already made mention to this already. Like the studies like the time motion study, right? So when that comes out, that shows that there's a significant reduction in the turnaround time, in the setup time. That means more cases could get in a shorter amount of time. That means we're more efficient. That means, 30,000 cut rate. If we finish a case 20% faster, all these kind of things turn around and mean we're more efficient. That's more money generated for the ASC. That's what they want to hear, right?
The other cost efficiency is being able to unify your machines. Yeah. So now all of a sudden you've gone from having to have 3, phaco machines, 2 vitrectomy machines, to it's a unified system. You might be able to get by with 3 machines because the vitreoretinal machines will also do cataract surgery, or 4 machines. And that's actually going to save you on a cost per machine, but it's going to save you on your, on your recurring cost of maintenance and upkeep. Your contracts to make sure that the machine's working and things like that. So going down from 5 machines to 4 machines or even 3 machines is going to have a significant cost savings over several years.
Yeah, super exciting, guys. I mean, like I'm excited to use this, and it's been awesome to hear your experiences both in the R&D phase and in your patients. Final thoughts. Tell me what you're excited about. Tell me what the next frontier is.
I'll tell you, from a Constellation machine that I've been using since I finished fellowship and I thought was phenomenal, and I still think is phenomenal. It was hard for me to see how, the Unity could make incremental changes that would excite me. I will tell you, I'm excited. I think from a control standpoint, That's what I'm excited about. I think there's intelligent fluidics, intelligent IOP control. I think from an efficiency standpoint, like John was already saying, if we could cut back on the number of machines that we have per surgery center, I think that's going to be impressive for our ASCs. And lastly, look, any new technology, tetra laser, single foot pedal, all of these things are one less barrier that just, that we deal with right now that I think is going to make us all more efficient. John?
Yeah, Sarwar, I'll tell you, it's rare that we have these experiences where you have a real game changer in technology. And the last thing that I was willing to buy myself for our surgery center was Ingenuity. And now I operate with it everywhere I go. It helps me train fellows better. This is the next thing that I said, you know what, I'm willing to buy this if you'll let me put it in the surgery center. And we're trying to figure that out. Surgery centers have certain laws and rules around kickbacks and buying and bringing in your own equipment.
Sure.
But it's literally something that I would be willing to buy myself because it's that much of an advancement over what we have.
And I didn't think about this earlier, but you're right. I think, new technology comes out, such as Ingenuity. And a few of my partners were very resistant in incorporating that technology in their surgical practice. And all I could tell you is right now, 99% of us use it for every case. And it used to be only for peels or only for RDs. We do a lot of IOL exchanges. Every single case uses Ingenuity. And that's the technology upgrade that John's talking about. This is that next technology upgrade. I think once we start using it, it's going to take off. I think everybody's going to be using it, for every single case.
And we have to get more efficient.
Yeah.
If you look at what's happening to our reimbursement for surgery, the ability to get surgeries in a timely fashion, we have to do things better and more efficiently. And this is going to allow us to take care of that volume of patients that's coming.
Yeah.
Super exciting, guys. Thank you so much for sharing your thoughts, opinions, and experience. We're signing out here from RetinaLIVE in Long Beach. Thank you, Matt and John.
Thanks, Sarwar.
Thank you, Sarwar.
UNITY VCS is indicated for use during anterior segment and posterior segment ophthalmic surgery. Federal law restricts these devices to sale by or on the order of a physician. Appropriate use of system parameters and accessories is important, as improper use may result in patient injury. Please refer to the directions for use for complete indications, warnings, and safety information. For full important product information, please visit unityvcs.com. References and disclaimers related to topics discussed in this podcast can be found in the description.